everyone's looking for that primary care provider. And I think we've made some significant strides, particularly in pharmacies and nurse practitioners. I don't think a lot of people know about those roles. It's pretty new, pretty fresh for people. I think it's significant work though. So can you just expand on those roles, what that actually means for us Albertans?
Well, first and foremost, Alberta pharmacists have the broadest scope of any province in the country. And largely speaking, I would say that we haven't been using them to their abilities. So, there have been a number of announcements recently. I took part in one with Shoppers Drug Mart where they're announcing that they're doing basically a walk-in style of pharmacy-led clinic in a lot of their facilities and planning on expanding that model. There are a lot of things that pharmacists have the ability to do without you having to go see a physician. And I encourage everyone to have a talk with their local physician or pharmacist that they are comfortable with and learn more about that. As I say, they do have a very broad scope, and I know that even in my communities, that people are waiting, in a lineup to get an appointment with a physician for a lot of minor issues that could be taken care of by another healthcare provider, i.e. pharmacist or nurse practitioner. So again, I encourage folks to have that conversation with their pharmacist. On the nurse practitioner front, we've had nurse practitioners working within our healthcare system for a lot of years. And currently there are, give or take, about 850 nurse practitioners across the province. And they've primarily been either working for Alberta Health Services or working underneath a physician in a clinic. And what we've recently done is we announced a pay model that will allow nurse practitioners to bill directly to the government, similar to the way that the physicians are compensated. Physicians, as most people are aware, are a private business. That, again, they bill directly to the government for their services. The one thing that Alberta government controls is how much to pay physicians, which is exactly what they bill us. So we're going to have a similar relationship with nurse practitioners who are willing to go out on their own and start their own practice. The reason this is significant is actually part of that deal that the nurse practitioners came to with the Alberta government is for them to carry a patient panel of 900 or more.
Interesting.
And we currently have a few 100,000 patients who are unattached to a primary care provider. We're hoping that will help alleviate some of that stress on the system.
Thanks for that. I think that those key pieces of direct billing and also panel size, that's significant. There's significant opportunity for nurse practitioners. To your point, I've heard of a couple of people in my community who are now thinking about going back to school now to be nurse practitioners because of that. So I think it's thanks for your work on that, Martin. I think it's significant, and we're going to see more people stepping in. So I think that's really cool.